If it can happen to two obstetricians, it can happen to anybody.
My name is Angela Sullivan. I am a physician and a mom of three.
Dr. Scott Sullivan. I'm a high-risk OB specialist, father of Abigail, a child who was born prematurely at 32 weeks.
As far as my pregnancy went, I didn't have any morning sickness. That was all fine. First trimester was fine, and I didn't really have any preterm contractions that I was aware of. I never really felt like I had any. Her movement was normal. I didn't have any weird bleeding or discharge or leading up to when I actually broke my water. I didn't have anything unusual happening.
So you just get a wave of fear. There was shock, and then a fear, and then there's just this realization that however it went, we didn't know if it was going to be a day or a week or what, but that you were going to have a child in the NICU. Having taken care of literally hundreds of people in the same scenario, you had seen times when it had gone well and times when it had not gone well at all.
So during those 2 days in the hospital, while we were waiting for the steroids to take effect and I was on the magnesium to stop contractions, I just felt like I was I was like on a wave, like a tsunami wave or something. I couldn't stop it. There was nothing I could do to stop it.
They actually took her back for the C-section while I was gone. Angela was doing okay, so I went with Abigail to the stabilization room. And it's a flurry of activity. There's 4 or 5 people, doctors, nurses.
I think for me it was difficult enough to see her strapped down and having the IVs in. At one point they put a scalp IV in, which is always scary looking because they use a vein in the scalp, and that always looks just awful and painful. She pulled a few out, and so they at some point they had her arms like strapped onto little boards to keep her IVs in. And so she did a lot worse than I was expecting her to do. It was really tough to see her like that and to see her kind of not get better every day, but actually make some turns for the worse and have some setbacks.
The low point for me personally was the second night. They called me and said that Abigail's lung had collapsed. And they're going to put a chest tube in to reinflate it. There's all these thoughts that go through your head in a moment like that of how I was going to tell her and how we were going to deal with it. And
up until about day 12 of her life or so, I think somewhere around there, we weren't able to hold her. Once we were able to hold her, that was just great, and that I really felt like she was going to do fine once we could get her detached from enough stuff that we could take her out and hold her skin to skin. That was really, really special.
It's still difficult for a while because you have monitors that go off all the time and visits all the time, and it's still a very long, slow process to get into what you consider to be normal. I think if we knew that this was coming, we would have done a number of things differently.
I would have definitely been to the doctor more and had either cervical exams or cervical length ultrasounds more frequently because I didn't have any of that.
Right.
And I probably would have paid a lot more attention to any kind of weird twinge or pain or ache that I was paying attention to if I knew that I had a higher risk of having preterm labor or breaking my water early or that kind of thing. We always have been trained to counsel pregnant ladies, especially first-time moms, about the symptoms of preterm labor. But I certainly became much more diligent about doing that after we had our own experience with it. Same thing with this. I think forewarned is forearmed, and if I had been able to know I was at a much higher risk of having a preterm birth, I would have learned everything I could have, so it wouldn't have been as scary and overwhelming because I would have already kind of mentally prepared myself. So to me, knowledge is power.